Welcome to Path Pulse, Pathology Innovators in Action, your go-to podcast for practical and implemented digital pathology insights.
Hello, everyone, and welcome to Path Pulse, the Digital Diagnostics podcast. This podcast showcases pioneers, innovators, and forward-thinking individuals within the digital pathology community who are making a difference in day-to-day use. So I'm David Dalton. I sit on the board for Digital Diagnostics Summit, and in today's episode, we're diving into the theme Pathology in Motion, a young pathologist's journey into digital diagnostics and social media education with Melanie Bourgeau. So Melanie, thanks for joining us, and could you just introduce yourself and share a little bit about your background and so the listeners are up to speed on you?
Of course. Thanks for having me. My name is Melanie Bourgeau. I'm currently a surgical pathology fellow at the University of Florida in Gainesville. Before that, I completed residency at Emory University in Atlanta, Georgia. And then I did a one-year bone and soft tissue pathology fellowship at the University of Colorado. And then after that, after this fellowship, I will be doing another fellowship in dramatic pathology at the University of Alabama in Birmingham. And in general, something that I've been involved with since residency is pathology outreach and education via social media. I've made about 200 assorted posts and videos on multiple platforms. I've also helped participate or create the Emory Case of the Week series when I was in residency, and I was also some social media management for the Georgia Association of Pathologists.
Very cool, very cool. Thanks for sharing that with us and getting us up to speed on your background. As somebody earlier in your pathology career, what was the first, your first impression when encountering digital pathology tools like whole slide imaging and AI?
Well, the fortunate thing that I started training, in the last few years, that it's always been a part of my education in some sense. Even during residency, we had a limited capacity for slide scanning for research and educational purposes, something I definitely took advantage of. When I was making posts for social media, I would use that to take photos and record videos. So it's definitely something I've always found beneficial.
Okay, great. And what part of that learning curve as you took on AI, whole slide imaging was the most surprising part of that?
I think the most surprising part was the lack of a learning curve. Since I've been kind of using both at the same time throughout training, it was never something that I had to completely switch in terms of adjusting to. I know some people who have been looking at glass slides for years and years, there was a bit of hesitancy and a sense that, I guess, even something was sort of lost in that transition from the glass slide to a scan slide. But I think that a lot of people have really warmed up to it, and I think it's just something that people, it just takes time to adjust to. Like when you go to an institution, the way they do their H&E slides, the color is always a little bit different. It throws you off at first, but after a couple days, couple weeks, you don't even notice it. So I think it's just
That's a great perspective. That's a great perspective, especially since you don't have a learning curve, basically, because this is all you've known, in all your training. You've been active on social media, sharing your insights as you go. What inspired you to start doing that? Is it just, your demographic, or what's the background there?
Well, I first got sort of involved, or at least was aware of the sort of pathology community on social media through Dr. Jerry Gardner's YouTube videos. I got recommended them during med school for histology review, his normal skin histology video. Someone recommended me, and I just immediately sort of was completely enthralled by learning about this, even just normal skin histology, and that's what got me into pathology in the first place. So from there, I learned about his Twitter account, all those other social media things, and that's how I discovered the pathology community. But my first, what really inspired me to make my first post was kind of a bit of a funny, bit of a embarrassing situation that happened with me when I was in my fourth year of medical school. I was at my audition rotation at Emory, and I was fortunate enough to get to observe sign out with Dr. Sharon Weiss for a couple of days right before she retired. So this was an amazing opportunity. I'm so interested in bone and soft tissue pathology. I was so excited. And I remember, I think it was like the first or second day, she just put a slide on scope and asked me what it is. And I said, fibromatosis. and it was a scar. So it's sort of embarrassing, but actually not that bad. They're fibroblastic, so I can give myself some credit for that. But I will never forget that. And then that inspired me to make my first series of posts on scars and scar-like lesions.
Gotcha. So it left a scar, no pun intended. So,
oh yeah, it did. I didn't think about that.
There you go.
But I say something that inspired me to kind of keep going was a little thing that happened midway through my first year of residency called COVID. That everything sort of shut down. Everything was very distanced. There was a lot fewer opportunities for just research and collaboration, and I really found a great community with pathology community on Twitter during that time. I was really inspired to keep making posts, keep learning, keep teaching others, and I made a lot of great connections through there. It's how I ended up actually meeting Jared Gardner and working with him on a paper. It's also how I found out about the Digital Communications and Pathology Fellowship, which I was a part of, as well as Kiko XP, which is a social media platform for doctors created by Dr. John Ho. And that platform also incorporates whole slide imaging, and that's what they have used a lot for my educational posts.
This is awesome. So, kind of going on to the next question, there's often a sense of, that innovation comes with seniority. How do you view your role as a junior pathologist helping kind of lead this change? How do you bring, kind of that innovative piece into this?
Mm-hmm. I would just say that I think our like my generation, we're very open to technology, but we're not sort of blindly accepting. We want something that's going to work for us, work for pathologists, make our life, make us able to provide the best patient care possible. So things that will help us make diagnoses easier, take some of the other things that maybe take away from our time away from just the diagnosis.
You being a junior pathologist and kind of to, others, even junior, senior, kind of the most senior even, what advice would you give to others who are just, obviously just starting out in pathology, or others that might be in it for a while that want to embrace digital tools, and to start sharing them publicly? What kind of advice would you give them?
First of all, I'd say that don't hesitate, just put yourself out there, just make your first post. I had people talk to me during residency about the stuff I was doing. They're like, that's so awesome, I could never do that. And there's the sense that if you're in training, it's not really appropriate for you to teach or make these posts or anything like that. But I think as long as you do your due diligence and you make sure what you're putting out there is accurate to the best of your knowledge, and there's no patient health information, I think there's nothing wrong with helping to educate. And I would say that you don't have to start with some insanely complicated, esoteric, high-level thing. I started making posts just about normal adrenal gland histology and hemangiomas and neurofibromas. And from there, I sort of found my own niche and found things, either cases that came up during my training or like papers I read, things that inspired me to make things that were more complicated as I went on.
So whatever inspires them specifically. Awesome. And then kind of looking ahead, how do you see the role of a young pathologist evolving in this kind of increasingly digital world? You came out of training being fully digital, but how do you envision that evolving over time?
I definitely see it as being more collaborative, the ability to share whole slide images with anyone across the world, essentially, being able to get that consultation from experts. I think it's really going to help with accessibility, help with getting, things to like diagnoses quicker, making better progress, because instead of having to ship the slides or ship the block from X to Y and then having to have pathologists look at them I think it's just going to make things more efficient and lead to better patient care.
Melanie, thanks for sharing your journey with us and your insights. That was really informative. I appreciate that. It's inspiring to hear how you're embracing the technology, because not every pathologist is doing that, and even pathologists in training aren't even doing that. So we really appreciate that as an industry, as a company, and to all of our listeners, we invite you to join us again next month for another episode of Path Pulse.
Thanks so much for having me.
Thanks for listening to Path Pulse, Pathology Innovators in Action. Tune in next time for more inspiring conversations with digital pathology experts.